introduce themselves. So if Rhea, you want to start off?
Yeah, for sure. Hi, my name is Rhea Shaberg. Pronouns are she, her, hers. I am a student at UWC, obviously, and I am on Towers Hall Council along with Samuel. And we'll have the counselors introduce themselves. Riley, do you want to start?
Sure. My name is Riley McGrath. I'm the Director of Counseling Services and a licensed psychologist.
All right, Roberta.
My name is Roberta West. I'm one of the therapists here at Counseling Services, and I also do general therapy, as well as I am the alcohol and drug abuse counselor, as well as eating disorder work.
Awesome. And then Stephanie, go ahead.
And I'm Stephanie Benish. I'm a therapist at Counseling Services too.
Wonderful. Thank you guys also for being here today. And I guess we will just start right off with questions. So the first question we have is, what kind of services do you guys have at Counseling Services, and what should we expect at an appointment?
I can take that one. So we have a number of different services that our office provides. The best way to get connected with our services is to call and schedule an intake appointment. What an intake appointment is going to look like is there's about 15 minutes of paperwork. It's filling out demographic things, letting us know what you're coming in for, and giving us a lot of background information that way. After you fill out the paperwork, we meet for about 45 to 50 minutes. We'll ask you a lot of questions, a lot of background questions, get an idea of why you're coming in, what's going on, how we can help. We'll ask questions about lots of different areas of your life, in addition to just why you're coming in. We'll talk about substance use. We'll talk about sleep, motivation, eating issues, lots of different things to get a better idea of what's going on in your life, family, academics. So then after that, at the end of that session, we'll talk about what next steps would be. And part of that is looking at, do you want to continue with this counselor for individual counseling? Are you interested in maybe trying something different, like group counseling, where you can connect with other students who might be going through similar concerns? Are you interested in maybe one of our workshops? If it's someone who really thinks that maybe they need more frequent services or things that we can't provide, we do have a case manager we could refer you to help get you connected with someone in the community for different types of services too. Did I miss anything, Roberta and Stephanie?
I don't think so.
Oh, crisis. Yes. If so the typical way people come in is through our intake appointment, but sometimes, especially in busy times of the semester, it could be a few weeks out for that intake. And if you can't wait for the intake, we totally understand if people need to be seen that day. We always have someone on call for crisis sessions, Monday through Friday, 8 to 4:30. During the semester, on Wednesdays, we're open from 8 to 6. During all those hours, we have someone available for crisis drop-ins. Usually, we can get to someone within about 20 to 30 minutes, depending on if the counselor's working with somebody else. But those are more solution-focused sessions, trying to figure out what's going on right now, how can we help, and how can we get you connected with what you need.
And it's important to know that even if you're working with a therapist out in the community or a provider out in the community, that crisis services are always open to students. So, for example, this summer, even if you're not a student, the fact that you're overall a student at UWEC, you certainly can make use of crisis services during those months as well. So there's just a rotation, and all of us are in on that rotation. And whether somebody comes in for a crisis session and gets the counselor typically accustomed to working with, or one of the rest of us, it's a roll of the dice. But those services are actively used and desperately needed, particularly probably this time of the year.
Yeah, absolutely. So then the next question kind of ties into what was mentioned earlier, but counseling services are booked out pretty far in advance, especially with those intake sessions. Obviously, crisis is another thing. And students can't see counselors as often as they would like, especially since I know you guys operate on usually like a case basis where you like get people in to get people out. This question is, do you have any alternative referrals for students who would like to see a counselor more frequently? I know you mentioned a case manager. Are there any ways that we can get those referrals?
I can take that one. So yes, the case manager. So somebody can come in, and usually at the conclusion of that intake, you kind of dialogue about what the services are that we can offer. And if a student feels like they need something more frequent, more intense, etc., then we can help facilitate that linkage to the community, or other campus resources. Maybe it's also a combination of referring them to the Dean of Students office or academic skills or any number of other resources on campus that might be helpful to them. So we provide them community resources as well in terms of, for example, Northwest Connections, which is a 24-hour crisis line. So basically that intake process, as Red mentioned, is kind of that pivotal piece that kind of shoots out all of those different options and kind of spells out and gives the person the option of what do they think most accurately fits who they are and what they're wanting. They also can don't have to go through an intake process, could just choose to, students can choose to, if they've come from a therapy background, just get involved with a clinician in the community and make use of some of those ancillary services, maybe workshops, maybe groups, etc.
I would add too that sometimes a plug here for Silver Cloud can be very helpful when you're doing therapy too, especially if you're not going to see your counselor till like the next week, because that's really focused on like in the moment and things you can do in the moment and tangible coping skills. So that can sometimes make it a little more manageable to wait like to see your counselor next week too.
And for those who don't know what Silver Cloud is, would you mind just giving a quick summary of what that is?
Sure. So Silver Cloud is an app, a mental health app that the university has for students and staff. And it can help you with depression, anxiety, focus issues, relationship, all kinds of stuff. It's module based. So you put in some information and then it will prompt some education about, what mental illness you're struggling with and some things to do about it so that things can change.
So it's very action oriented. You get involved on the front end, do that assessment piece, but there usually is some clear-cut action, which most students are finding very helpful, just to be able to know how to impact on their own behalf.
Yeah, absolutely. That's an awesome resource. Okay, the next question that we have is, how can I find a counselor in counseling services whose style or expertise fits well with my needs?
I can take this one, or Riley, or
Oh, go ahead.
A good place to start is on our website. We do have, staff bios on our website too. So if you're looking for a certain kind of counselor or a certain specialty, sometimes that can be a good starting point. The other thing is when you come in and you do an intake, you get a feel for the counselor and kind of the questions they're asking. And there's nothing that says, you have to stick with that counselor. Once you have an intake, you can meet with somebody else and then you meet with that counselor regularly. But we do have quite a few counselors. So, if it's doesn't feel like a good fit, you can transfer to somebody else. And sometimes it is, your therapist is intentionally trying to push you to make some changes too. So I would always say, lean into that discomfort a little bit sometimes, because sometimes it's definitely, there's a reason for that too.
And to add to that, I think also if students have any background with counseling and they've worked with somebody in the past and they thought it was incredibly helpful, I think the front desk is also going to be very sensitive to a student calling and just saying, I want someone who's kind of soft and gentle, or I want someone who's more confrontive and is going to push me to grow, and just kind of delineating that for the front desk. I think they have a sense too of who they might match that person up with.
Yeah, absolutely. It's very much a personal thing. So just connecting with you guys and being clear with what we're expecting, for sure.
I think one last thing to add there is just letting the counselor know what you're looking for too, because some of it is more personality based, but some of it also, like, we all have diverse skill sets, and depending on what the student is looking for, we will sometimes adapt our treatment differently. So if this has been a little too passive, or I need someone to give me homework assignments or tell me what to do, we can certainly adapt our styles too.
Yeah, awesome. Okay, next question. This is two questions. I guess we can kind of lump it into one though. So ideas on how to relieve anxiety, and then along with that, how can you help? How can you relieve stress? So anxiety and stress, listening both of those.
I think the first thing that comes to my head in response to both of those is go to the Silver Cloud app take a look at what the resources are within that app and some of the exercises that might be helpful. Another thing that's on our website is if students are, for example, with regards to anxiety, we have some videos that are posted on there for attacking anxiety and depression. And those workshops in the past have been very effective at kind of helping students to develop some skills of how to manage. So if it's a skill thing that people are looking for in terms of, I don't know how to cope with this, I don't know how to deal with it when it comes up, those are some of the preliminary resources that they can check out, and then perhaps look at, do they want to get scheduled for an intake session and formally start therapy?
Yeah, I was going to add, especially for stress, the one thing that I always, ask students about at the get-go is, what are your self-care strategies? How do you self-soothe? How do you get back to baseline and feel regulated and calm and at peace? And if those things are lacking, then how do we bring that back in? I know students are very busy and they have a lot of demands on their time. So sometimes those things get relegated to the back burner and they don't get prioritized. And sometimes it is just a matter of, how do I bring those things back to the forefront and schedule those, just as I would schedule study time, or, I go to class, I'm going to schedule some self-soothing time, some downtime, things that help you feel human and normal again, and not just like a little worker bee who's always doing homework and taking tests too.
Yeah, to add on to what they're both saying, first of all, I'm going to throw in our chat the link to the YouTube page, and then I don't know if there's a way for you all to throw that into the live stream.
Yeah, Samuel can throw that into the live stream chat. Samuel, if you wouldn't mind doing that.
But yeah, doing things, just general self-care stuff, taking care of yourself, prioritizing things like exercise. There's meditation is another cool thing. Progressive muscle relaxation is something that's really helpful. Deep breathing exercises, and there's a million YouTube videos to cover these different things. So some of this you can do online, but certainly working with a therapist can help more individualized plans for helping with anxiety and stress too.
Yeah, absolutely. Okay, our next question came from the live stream, so I'm going to put it into the chat for you guys. So the question is, so my friend told me that they have depression and I feel like I should help them, but I don't know how to because they often drive me crazy, and it's better for my mental health to avoid them. What should I do?
I would say be honest with your friend. You don't necessarily have to say you're driving me crazy, but tell them that this is a little bit hard for me, and also go back to just kind of the reasons you're a friend with that person. Listening to them, when you're listening to them, validating them, that can be really important, and just being there for them and offering that support. And then having the conversation of like, okay, I'm here for you, cool, we're friends. And I think maybe you should talk to a professional, or you should reach out to counseling services. I think that you need more than, just a friend to hear what's going on too.
Yeah, definitely after that, it sounds like a perfect example of a time when it's important to set boundaries and let your friend know the limits of what you can offer, and providing that balance of I'm here for you, and the best thing I can do for you right now is connect you with more professional support.
For sure. Yep, those boundaries are vital. Okay, next question, I'll put that in the chat for you guys as well. How do I stay on top of work while trying to get an ADHD diagnosis? I can't get anything officially from the school until I am diagnosed, and I'm behind in my classes.
That's a very timely question. So we've been working this semester with Student Health Services on being able to adapt this sort of assessments that we can do in-house for ADHD screenings and assessments. And we're in the process, actually, today LTS is here physically trying to set up the final part of our screening. So we've been doing general symptom screenings, but that's not enough to provide a diagnosis to get support through student disability services and things like that. But the test that they're installing today is called the test of variables of attention. And once we have that and can add that into our general screening, that will be enough, depending on what the results are of all these different screenings, to be able to provide a diagnosis.
And in the interim, would you suggest anything for those students that might believe they're, that they meet that criteria and haven't yet approached our office?
Yeah, well, and ADHD is, there's multifaceted treatments for it. So certainly medication is one thing that a lot of people are interested in. And Student Health Services has been working with students prescribing medications for that. There's also lifestyle things to look at, setting a schedule, having a routine set. Nutrition and exercise are certainly really important for adding balance when you do have ADHD symptoms, with helping with concentration. So yeah, there's a lot of things that you can do just with your own wellness, setting reminders for yourself, having to-do lists, those sort of things can be really helpful.
And I would add, you can rope your friends in on that too, like telling your friends, like, I am behind. Are you behind? You want to study together? Let's set up a study date. See if there's any studying going on with other classmates in your classes. Reach out to the Academic Skills Center too. They have tutors and they have groups that meet too, and just kind of sometimes it's easier to do things if you have a group to do it with too, and that external factor can go a long way.
Awesome. Okay, next question I'll put in the chat as well. What are good questions to ask or things to say to friends who have depression and are or have been suicidal?
So I will jump in on this one. If your friends are struggling, especially if they're having suicidal thoughts, you want to, give them some crisis numbers, tell them to call us. And Roberta mentioned Northwest Connections. There's also a lot of really cool crisis supports I saw on your website that you have up there for Towers North Mental Health Site. And then, just also being there for them, listening to them, asking them what's going on, and then connecting them with more resources.
Yeah, sometimes it's just needing that extra push to get help, or so being able to really let them know that you're here as a friend. And when in general, when you're saying, how are you doing, wanting to know that I really want to know how are you generally doing? Most people are feeling pretty stressed during this last year for a number of reasons, because of the pandemic and other things. So making yourself available to just be a place for someone to open up, but then also to let them know that, yeah, there's a ton of resources on campus and off campus. Like Stephanie mentioned, the crisis numbers, there's a crisis text line. There's a ton of, I haven't seen the Towers North website yet, but there's a ton of identity specific crisis lines too. So I don't know if some of those are on there or not, but we have some of those on our website through our crisis tab as well.
And sometimes to tie into that, sometimes students that are really depressed or feeling really suicidal are a little hesitant to make that call on their own, to reach out to those resources. And sometimes just offering as their friend to sit with them while they make the call, I will stay here and sit with you when you call Northwest or when you call counseling and get that process started. Sometimes that lessens the fear and how intimidating that process can be on the front end. So sometimes just sitting in their presence.
And those resources we have them on our website. Samuel, if you want to drop the Towers website link in the chat as well. So those resources are on the Towers website. It's for both Towers North and South. We also have a wall up in the lobby, kind of by the Towers South side. We have a lot of those numbers listed. So we have a lot of those resources. We have Silver Cloud up there and all of that sort of stuff, QR codes for all of that. So those resources that Stephanie, Riley, and Roberta all mentioned are all available to you guys as well in different areas, as well as on the counseling website. All right, and then this is the last question we have. I don't think we have any more questions coming in live. But relative to the pandemic, what are some coping strategies that might be helpful for students who are experiencing increased isolation due to COVID-19?
I can start the conversation and jump in on this one. So yeah, a lot of people are feeling isolated and having those feelings of loneliness because we are in, social isolation. So one thing that I always like to think about is when there are so many things that are outside of your control, like COVID and some of that stuff, is what are those small things that are inside of your control? What are the tiny things that you can do that can remind you that I do have some control over this? I'm not totally cut off from everyone. You know, small things like, what am I going to wear today? Or what do I want to eat for lunch? Or who do I want to text this, tonight? Like, what are those tiny things? And kind of going back to that, while then trusting that like things will go back to a different sense of normal, and thinking about that time and what are you excited to get back to doing when there aren't so many restrictions due to COVID.
I also think it's important to, especially with the weather changing and improving and it's getting warmer outside, that think about whether or not some of that, pent up over the winter with the whole pandemic and people feeling very detached from each other and not spending time together, that now that we can be outside, maybe some of those avenues open up, and that maybe it kind of challenges that creativity to come up with outside options where you're not going to really put yourself at risk, and yet it's going to bring back some of those familiar feelings of connection to other people.
And I think just to add to all this too is a reminder that the vaccines are now readily available on campus, and there's Zorn Arena access right now. So if one of the things that's prevented you from getting out there and being more active and around others is fear of COVID, knowing that taking that next step to get the vaccine, I would really recommend doing that.
Absolutely. Anything else you guys have to add before we start wrapping up here?
I was just going to add with that last question, take advantage of all the mental health and mental wellness activities that the university has put out from now to the end of the semester too. Like, bubbles and hula hoops and therapy dogs, the library, and all of those things too. Like, if you're feeling overwhelmed and anxious and having some depression symptoms and it is prompting you to isolate, don't give in to that. Don't isolate. Do the things that are out there that the university has also organized too.
Yeah, absolutely. Yeah, we've got a ton of stuff going on, especially today since we got our wellness day today. But just taking advantage of those. Yeah, so just wanted to thank you guys again for coming and joining us today and spending some time with us with these questions. Thank you to everyone on the